Do the Covered California star ratings have any value? Hi, I'm Kevin Knaus with InsureMeKevin.com, and if you purchase your health insurance through Covered California, you have seen the little star ratings for the different health plans. And that is meant to help guide consumers in selecting a plan. But what value is it and what makes up these star ratings? So the star ratings are comprised of three categories: medical care, patient experience, member experience, and plan administration. Now, how they develop these is that there's a voluminous amount of patient data that is collected from the health plans. And they're looking at all kinds of different things. And there are also member surveys. It is a very detailed process. The methodology is above criticism. They've been doing this for years within Medicare, so they've got it dialed in. My issue with the star ratings is that there is a higher weight given to medical care within the star ratings, and they don't necessarily do an analysis or kind of break down the health plan and how it works in a PPO situation versus an HMO. But let's look at the medical care. When you have a colonoscopy, your health plan is not doing the colonoscopy. The doctor is. The health plan just pays the doctor. So why is there so much emphasis given to the medical care? Now, of course, the health plan creates the networks. They contract with doctors and hospitals and facilities. But, the health plans don't get involved too much with your healthcare decisions, and you don't want them to. This is between you and your doctor. I believe a greater emphasis should be on the member experience with the health plan and how you interact with the health plan. So let's kind of look at the star ratings here in California, in Covered California. And you can see in general that HMO plans generally have a better overall star rating and are higher in many categories. The EPO and PPO plans, those plans that allow you to just go and select any doctor you want for a primary care physician or a specialist, they're lower. They sometimes don't get as high of ratings. I contend that the HMO plans get higher ratings because they coordinate the care better. So when you go to your primary care physician and they make a determination you need to see a specialist, they make that happen, or they send you over to get a test, they order some sort of x-ray, and all that information comes back to the primary care physician, and they're kind of looking at it. It's all kind of coordinated within the medical group and the hospital. And that generally leads to better patient outcomes in many situations. However, some people don't like kind of that structure, and they want to see their own specialists that maybe they have known for years and years. With the PPO and EPO plans, freedom to choose, you're choosing your doctors, and they may be in different medical groups or not in a medical group at all, and there can be a lack of coordination when test results come in and needs to get over to the primary care, and there's different prescriptions that need to be ordered. Who's looking at all of that? That responsibility oftentimes falls to the member, to the patient. I do not believe that we should be assigning that kind of coordination to health plans. It should be within the medical groups. How we get better coordination in a PPO plan, I'm not sure. But that is one of the issues. And so that causes problems and lower satisfaction with overall care because maybe things get dropped. The tests don't get ordered the way they should in a PPO or EPO environment because it is on the member to make the arrangements who is sick, is ill, and possibly in pain. And if you do not have someone by your side, a true patient advocate, sometimes things just kind of fall through the cracks. So in general, HMOs do get better ratings. But you know what? I have clients, like the LA Care, 2-star ratings. I have clients that love LA Care. They love their doctors. They love the medical groups. They think LA Care has done a wonderful job when they interact with that health plan. So it is difficult to say that these star ratings replicate or will be your experience with the health plan. So when you go to Cover California and you're looking at all the different plans, you'll see the different quality ratings. Now, if you find a plan that has your doctor in it and a low quality rating, like, oh no, I shouldn't select that plan. No, you need to think about everything that's going on with that health plan. Also, a big thing is the price point. Some people will choose plans with a very inexpensive monthly premium that may include their doctor, but it may be a PPO or EPO, and there may be some issues. But that's what also guides people is the cost of the plan, not sometimes so much the quality rating. And the plans themselves have really increased and improved the overall member experience and people interacting with the health plans. One of the real weak links is the provider search, because many of the health plans have many different networks and it's difficult to sort through them. Sometimes the plans only work with one type of browser and you can't find something. It's very frustrating. And sometimes they may not have a lot of customer service staff. And this can be similar in a PPO, EPO, and even a very highly rated HMO, because it comes down to people. So that's something that all the health plans need to work on, is, making it easier for people to find the right doctor for their particular situation. And that may be another bridge too far at this point in time, because it takes specialized people to interact with the member to find out exactly, okay, what's going on without making any medical diagnosis. There is one organization in California, the Office of Patient Advocate, that also creates star ratings similar to Cover California. And it is the Office of Patient Advocate, and they create a health plan report card and also a medical group report card. And you can go to the California Patient Advocate and you will then see some of the plans that are group plans, because they're also rating health plans for small and large groups. And you'll see that the PPOs generally don't have as high a satisfaction rating as the HMOs. Again, it's a coordination of care issue and also the network size. When you enroll in Kaiser, all the doctors are available that you may be referred to. With a PPO plan, the individual and family plans have a narrower network, and so some of your favorite doctors from a group plan may not be in it. So that kind of rankles you, because you can't see your favorite doctor. But what is really interesting on the Office of Patient Advocate is the medical group ratings, because in general, the health plans contract with medical groups and independent physicians, but you will probably be seeing a doctor in a medical group, or you can select a doctor that is in a medical group, and you can see the star ratings for those particular medical groups and how people feel about them, because those are the people that are providing your health care, not the health plan. Again, the health plan is not doing your colonoscopy. The doctor is. Health plan's just paying for it. So do the star ratings have any bearing? Yeah, sure. You just need to understand the context and the background to it, and play around with the different health plan websites and talk to your friends to see how they have interacted, what kind of issues they're having with billing or prescriptions and whatnot. Those are the bigger tells when you're selecting a health plan for interacting with health insurance, as opposed to the medical care. So hopefully that kind of helps you out. You may have other questions. You can leave those comments and questions down below. You can go to my website and find my contact information. And I am Kevin Canals with InsureMeKevin.com, and you have a beautiful sunny day.